I would like to welcome everyone here on behalf of the Ministry of Health to a press conference called this afternoon to explain the new COVID-19 regulations that will come into effect next Monday, September 20th, 2021. To begin, I would ask everyone to please stand for the playing of the Belgian National Anthem, followed by the playing of the Belgian National Prayer.
Almighty and eternal God, who through Jesus Christ has revealed your glory to all nations, please protect and preserve Belize, our beloved country. God of might, wisdom, and justice, please assist our Belizean government and people with your Holy Spirit of counsel and fortitude. Let the light of your divine wisdom direct their plans and endeavors, so that with your help we may attain our just objectives. With your guidance, may all our endeavors tend to peace, social justice, liberty, national happiness, the increase of industry, sobriety, and useful knowledge. We pray, O God of mercy, for all of us, that we may be blessed in the knowledge and sanctified in the observance of your most holy law, that we may be preserved in union and in that peace which the world itself cannot give. And after enjoying the blessings of this life, please admit us, dear Lord, to that eternal reward that you have prepared for those who love you. Amen.
You may be seated. Thank you for your attention and your reverence. We will now move into the agenda items for the press conference this afternoon. To begin, I'll introduce myself. My name is Claudette Dakers-Norales. I'm the Information Officer at the Ministry of Health and Wellness. We will be doing things a bit different this afternoon. To begin, I will call on the Chief Executive Officer in the Ministry of Health and Wellness, Dr. Daisy Mendes. She will be doing introductory remarks, and also she will be introducing the members of our head table here with us this afternoon. Dr. Mendes.
Good afternoon. Thank you, Ms. Claudette. Really, it's with great pleasure that I stand here to be given the opportunity to welcome the media and our listeners at home and at work. As we as a team at the Ministry of Health and the Medical Task Force are gathered here today, or some of the members of the Medical Task Force gathered here today to provide an update, clarification, the purpose and importance of the new measures that will come to effect, as previously mentioned, on the 19th of September. I take great pleasure that I've been able to work with a group of expertise, a group of doctors with experience providing great advice, and I'm honored to be here to present some of the members, because here today is just some of the members of the task force. And I start off with the introduction and of Dr. Marcelo Coy, which I know the doctors you'll see today are no strangers to the public and to this country. Dr. Coy, thank you so much for being with us today. Another of our member and also one of our own at the Ministry of Health and Wellness, Dr. Julia Sabido, also a member of the task force. Dr. Andre Sosa, who sits with us as an advisor, also representing as the chair of the KHMH National Referral Hospital in country. Dr. Sosa, thank you for being with us. And Dr. Melissa Diaz-Musa, who is presently acting as our regional manager for the Central Health Region, and being one of our hard at work in the field, in the district and in the country, forming a part of the response team and making things work for us and for the people she serves in this community. Dr. Diaz, thank you for joining us. And Dr. Adrian isn't here as yet, but I'm informed he'll be a little bit delayed, tied up with some clinical work, I guess, but he expresses his apology for being a little late, but will be joining us shortly for his input as he gives further clarification to the situation at KHMH. Ladies and gentlemen, thank you for joining us and welcome.
Thank you very much, Dr. Mendes. We will now start with remarks from Dr. Julia Sabido. He is the representative from the Ministry of Health and Wellness and also a member of the Medical Task Force. He will be doing a presentation for us. I call on Dr. Sabido at this time.
Thank you, Claudette. Good evening, everybody. It's not really a presentation, but I'm going to give an overview. Sorry. No? Good evening, everybody. It's not a presentation, as I said. I'm going to give an overview of where we are with the COVID pandemic. As you all know, the first case was identified or was diagnosed in Belize on the 23rd of March 2020. So for the past 18 months, we have been battling this deadly pandemic, this COVID-19 virus. And up to yesterday, the 15th of September, there are a total of 18,143 confirmed cases. The total deaths are 385, and we have 1,474 active cases. With respect to the hospital admissions and deaths due to COVID-19, so from a subset of data within the time period of access to the COVID-19 vaccines, which is from June 1st to September 13th, there were 187 COVID-19 hospital admissions, of which 77.5% of these admissions were unvaccinated patients. 16% had only 1 dose, and 6.5% had 2 doses of the vaccine. From April 1st to September 13th, there were a total number of, 51% of the deaths due to COVID-19 had no vaccine. 7% had only 1 dose of the vaccine, and 11.3% had only 1 dose of the vaccine, and 6.5% had 2 doses of the vaccine. The measures that the medical response team has recommended and that the government has acceded to are as follows. So for a period of 2 weeks, starting on September 20th, 2021, ending October 4th, 2021, there will be a curfew starting 7 p.m. to 4 a.m. countrywide, with the exception of Ambergris Key, Key Cocker, the Placentia Peninsula, and Hopkins. Now, the curfew for these destinations remain 9 p.m. to 4 a.m. Restaurants are to provide take-out service only, with the exception of restaurants in those areas that I mentioned just now. Churches and casinos are to close. Contact sports will not be allowed. And there will be a no movement, or there will be 2 no movement days. One which will be Sunday, 26 September, and the other which will be 3rd October. Movement will be allowed only for medical attention, to purchase medication, to purchase food, to purchase fuel, and for travel to and from the Philip Goldson International Airport. Now, in the list of exceptions, as I said, purchasing of essential needs of food supplies, fuel, and pharmaceutical drugs or medicines. For medical attention, and the productive sector will be allowed to work. People are asking, what about the hotels and the resorts? Those that work in those establishments will be allowed to go to work. Bear in mind that the police can, or the security forces, I should say, can stop anyone and ask them the purpose of why they're moving. We're hoping that these people already have an ID from where they work. I mean, it's not the first time that something like this has been mandated or these measures have been taken. But with these new measures, the intention is that we are going to avert a further 250 new infections, an additional 150 COVID-related hospital visits countrywide, 15 ICU admissions, and a minimum of 10 deaths. So that is the intention with which these measures were proposed. And I think you all know what the situation is at the Karl Hushna Memorial Hospital, how they are overburdened. The healthcare staff, nurses, doctors, pharmacists, lab techs, everyone are tired. And so with these new measures, we're hoping that these healthcare workers can get a break and they can get some much needed relief. So those are the measures. Later on, I guess we're going to do the question and answers, but that's the long and short of it.
Thank you, Dr. Sabido. At this time, we will be hearing from Dr. Marcelo Coy. He's also a member of the medical response team. He will be expanding a bit more on the purpose of the regulations. Dr. Koi.
Am I so short? Thanks very much, Mrs. Claudette Dakers. I know most of you know me as an obstetrician, gynecologist, but fortunately in my younger years, I used to like to study, and I did a master's degree in public health. And it is in that background that I believe I was asked to be part of the task force for the Ministry of Health. What I would like to do is give some background information that is commonly used in epidemiology, commonly used in public health, but which has bearing as how to more interpret the statistics that was given by Dr. Sabido, and also the rationale for the public health measures that were also mentioned by Dr. Sabido. One of the first terms I want to use is called the RO number, or R number, which I think stands for reproductive number. And it kind of like gives you an idea of how much one infected person can spread that infection to other persons. And the R number for the original alpha variant, we wouldn't call it alpha variant, the original virus responsible for COVID-19, the R number was 3. So it basically meant that if you did nothing, one infected person with COVID-19 could infect 3 other persons. If you look at comparative, for example, to HIV, which is another epidemic we had many years ago, the R number was 4. The influenza, which is common, every year you get that influenza increase around October, November, December, the R number for that is 2. And for something like Delta, it is believed that depending on which study you read, that the R number is between 5 and 9. So if you look at it, it's twice to 3 times as more infective as the alpha type of COVID virus. Now, how do you reach at that rate, at that number, the R number? And it's based on several factors. One of them is the positivity rate of the infections that you get. For example, right now, I think yesterday was about 12.9%. So of all the tests that they do, 12.9 of them were positive. So that's a factor that's telling you that, and contributes to the R number. It's related and depends on the number of hospitalizations. And at all the hospitals, you see an increase in hospitalizations. I think the numbers at Karl Hushna about year 2 was about 30 people admitted to the COVID unit in various types, whether it is ICU and non-ICU. It's related also to the death rate. So obviously the higher the death rate, the higher the R number. It's also related to the infectious period of the disease. So if you can spread that virus for a whole week, it means you are spreading it to other persons for a whole week. That increases the number. Depends also on how that virus is spread. And in our case, it is through airborne, which has a much higher rate of transmission than when using it through body fluids. It also, on the contact rate, how much contact is there between one person. So if you have one person who stays at home and has contact with one person in the family, as opposed to one person who has a job that goes all over the place, that contact rate increases. So obviously, the R number depends on all these factors. And the target really is to have an R number below 1. That is how it will eventually not propagate itself and will die out. And that is the purpose where if we want to have public health measures to decrease the R to below 1, this basically, we want to stop the propagation of it. I'd like to go back and summarize also how does the COVID-19 virus spread. And the majority of it, 95%, is through droplet infection. When you speak, or you sing, or you talk loud, little droplets of saliva with the virus is spread. And this is how this particular virus spreads in the majority of time, 95%. It's thought to just be about 4 to 5% that spread through contact, where you touch a surface that either the infected person touched, or through the droplet infection, it landed on the chair, for example. It's not the main one. And the third one, particularly of concern for us doctors, is what we call aerosol spread, where the saliva doesn't go and drop somewhere. It continues into the air and stays there. So when you come an hour, 2 hours later in the room and nobody in there, you could still get infected. So that's less than 1%. So for practical purposes, it's a droplet infection. I'd like to speak a little bit about risk, because it's important for us to know that the risk, you can rate it 0 to 100. It all depends on your behavior. And obviously the purpose of the mask, and there are 4 or 5 main things that can, in terms of COVID-19, that the use of the mask decreases the rate at which you have droplet infection. So in instances where, for example, you do not use your mask, like when you're eating, when you're in a restaurant, when you're in a bar drinking, and it increases the risk of you getting the virus through droplet infection. If you're close to each other, and when you speak, and there are several studies that tell you that the safe distance is 6 feet on the average. And so if you are in a particular restaurant or a bar next to each other, you increase your risk of getting an infection. It depends on the contact time. Persons, for example, who come to my clinic and I spend 15, 20 minutes, and that person is positive, you would call it a casual encounter. The risk is very minimal, as opposed to if you spend 8, 10, 12 hours without a mask, then your risk increases. It depends on the quality of air, because of that aerosol part, that if you are in an AC room like now, it increases your risk as if you're in an open air environment. And that is why you will see that the restaurants, they say you can have a restaurant open, but only sometimes, earlier they said only on the outside, no AC, and why in fact now we say only pick-up. And obviously the last one is movement. And there can never be a zero risk. If a person travels, lives in Belize and goes to Belgian every day to work, and I hope you're not one of those, Mrs. Dakers, your risk of a motor vehicle accident is high because you will travel twice as opposed to a person who stays at home. But the risk is not zero because some crazy drunk man may be driving, run off the street into your room and kill you, and you have a motor vehicle accident. So the risk is never zero. And all of these measures have different levels of risk, and it's really, the idea is to minimize the risk. Okay? You can never bring it to zero. The last comment I want to put is on vaccines. And vaccines really have not come up to decrease the transmission of infection. All right? You see it very clearly, for example, in Israel, which has about 65, 68% of vaccination rate. and they have a high transmission rate. That R factor is high, and you see a huge, huge spike. But you do not see the hospitalization and the death rate. So the incidence is high, but the hospitalization and death rate is not. So vaccines really, for our intents of purposes now, is not going to stem that hospitalization and death rate that you're seeing. It's more an investment for the future. Down later in the year for next year. And so, yes, we need it, but that is not going to play a factor in the hospitalization and death rate. More so that only 20% of our population is fully vaccinated. And that is what counts. Make nobody fool you that one vaccine is good enough. It's not. You need the two of them. So what do we need to do? Well, obviously we have a problem because the R factor is very high. We have a lot of people coming up, and you see it in the positivity rate. In some places as much as 75%. Nationally it's about 12.9, but in some clinics it's as high as 75%. So it's high. And our aim should be to bring that positivity rate down to below 5, where it was before April, where we were down to about 1 to 2%. We also need to do that to decrease the demand for the hospitalization that is taking place. Because if we do not do anything, you're going to have pictures here similar to what you see in our neighboring countries of Guatemala, where people are attended to in the corridors of the hotel, similar to the pictures where you saw in India. Is very easily to reach because there's a capacity to how much we can attend to. And Karl Hushna have their plans, plan A, plan B, plan C. They're at phase 3 now. But there's a limit to which they can go. It may be 40 beds. Or if they go to more than that, it means that the ordinary heart attack and what have you that you need, they can't attend to them, and they will look only COVID. So we need to do something to decrease the R factor, decrease the hospitalization, and so, as somebody mentioned, to give the doctors a breathing time, but that's a secondary thing. The main thing is we need to decrease the admission rate to the hospital. The vaccination is good. We need to bring all those persons who have only have one dose, because I know several people think, well, I'm protected with one, you are not. We need to bring that 95,000 people who have only taken one dose to come and say, move us to get fully protected with the 2 doses. And it's only if we do that, we'll be able to avert a catastrophe in Belize. Thank you, Madam.
Thank you very much, Dr. Koi. Always good to share your information, and it's always another opportunity for persons to learn more, and the reiteration of this information is very useful. Thank you. At this time, we will call on Dr. Andre Sosa, who will be speaking about the negative implications of the burdening of the health system. Dr. Sosa.
Good evening, viewers. I will speak from the perspective of the KHMH and for the need to try and keep numbers at the lowest possible level. For purposes of illustration, I will mention that in the 16 days of September that have passed so far, we have already had 62 admissions to the KHMH. In all of August, we had 61 admissions. And August marked the greatest number of admissions since last year. So obviously, there is a problem. Our COVID ward was designed for 23 persons. For the last 2 weeks, we've been at 30 persons, more or less. So obviously we've had to make more space to accommodate those additional patients. There is more space that we can make use of. However, that space is not unlimited. And with more patients, there is a greater need for staff and a greater need for equipment and other resources. Again, those are not unlimited. When you increase the number of patients and the ratio in comparison to the personnel, the doctors and nurses who are there to attend to them, that can affect quality. The delivery of care can be affected. If you have one nurse or one doctor for 8 or 10 patients, obviously the quality of care slips. So all of those things we have to take into consideration when we plan our measures to try and control the pandemic. On a happy note, today marks the first day that we have dipped below 20 cases admitted. We are at 19. Sadly, however, we have already experienced 2 more deaths today. The deaths continue to add up, and each death is a tragedy for the families, for the country. And it's important for us at the KHMHA to be able to continue to provide our services. We will do whatever is necessary to make sure those services are delivered, but also to keep you, the public, informed. You've seen over the last week or so that we've been on the media trying to alert you, appraising you of what is going on and of the efforts our staff continues to make to give the best possible care. I think I've said enough with that, no?
Okay, thank you very much, Dr. Sosa. Moving on, we will now hear from Dr. Adrian Koi, also a member of the medical response team, and he is also the medical director at Karl Hushna Memorial Hospital Authority. Dr. Koi.
Good evening, everyone. Dr. Sosa already gave a good capture of the numbers that we've had or having. Every death is very, very sad for us. It's a failure of not only the condition, but a failure in the sense that ultimately, despite all the very valiant efforts, especially from our very impressive primary healthcare response that we had early in the year, which for many of us gave us a feeling of safety. We felt even that we were at the point of, all the measures that were relaxed, reaching the point to do our sports and so many other things. But as humbling as this virus has been from the very beginning, it is teaching us that we cannot ignore the science. We cannot ignore what's happening around us. So that even Belize is going through something that's exactly the same as everywhere around us in the world, in this region, many times more, in the Caribbean, unprecedented numbers. So again, to reiterate, from the hospital's response, we have seen the trend from early as July that this was going to be worse than last year. We saw admissions going from 26 to 61, and as he said, we already not even halfway in this month, and we have 67 admissions or so. So we are on track to be at least 120, 150 admissions for this month alone. And most of the patients are just not well. We're not admitting patients because we want to keep them company, and in fact, we're trying our very best to keep them out of trouble. Again, to put in perspective, the adult ICU that we have usually has 150 to 200 admissions a year. And if we are going to see 150 admissions of very sick patients within a month, again, this is very, very crushing for our health system. Very crushing for Karl Hushna in more ways than one, but we represent the center where tertiary level care is to happen. But we are also the center where care has to happen for everyone else, apart from COVID. So while COVID takes out all the air from the room by its presence, we have many other conditions that we have to be able to respond to. The most tragic thing for us is to have to close our clinics and our elective cases. Again, that has a huge impact on our Belizean population right now. The fact that we have widespread community spread in Belize City in particular is very dangerous even for our healthcare professionals, those who are trying to help others. So we are in unprecedented times. We are many more times worse by the way of the infectivity and the numbers that we saw even last year. Again, to put in perspective, last year the maximum in 1 month admissions that we had, and when everything looked so bad, was only 40 admissions in that month. So I can only share from our perspective that we have been trying to do our very best. We do operations on patients who are quite unwell with COVID. We have done 58 operations over this period of time. And we really have we have the largest experience for the very unwell patients. So in spite of the fact that we see numbers that are very scary, and that means we have seen deaths. For this year, if we've had 223 admissions. So 223 admissions, and in total, we've had, unfortunately and very sadly, 52 deaths. I will share one last number. Last year, for the same period of time, 153 admissions and 75 in-hospital deaths. So this, again, is not anything for us to be in any way happy about. Whatever can be done to diminish this continuous pressure across the country, because Karl Hushna is just one version of where things are happening, but we know that Western Region and all the other hospitals are having cases, they are having deaths, and patients don't have a chance even to be transferred to Karl Hushna. Again, it is a very seriously futile event when we reach the patients who are critical and have COVID. And this is universally applicable. No matter where you look, in Jamaica they're reporting 21 deaths a day, Guyana 9 deaths a day. I mean, everywhere, and maybe they're even under-reporting. I mean, that's something everyone seems to sing about, but it's very difficult to pin all deaths as they are happening as to whether they're COVID related or not. The message that I think has to be delivered is that we are in our worst case scenario. We are where we do not want to be, and we've been there for too long. Thank you.
Thank you, Dr. Koi. Thank you for your message this afternoon and for your plea. And we thank you for sharing on the situation presently at Karl Hushna Memorial Hospital. We have come to the end of the remarks section for this press conference this afternoon. I'd like to thank everyone on the head table who provided remarks. At this time, we will be inviting the various media houses to ask questions to persons here at the head table. I will ask that the questions be in relation to topics discussed here, information discussed presently here at this press conference. We will only be allowing for 2 questions per media house. I ask you for your cooperation. You can step up to the mic. You can please introduce yourself, your name and the media house you're representing, and you can ask your 2 questions. Thank you very much.
Good evening, members of the head table. Orson Picard, Crown Television News, Belize City. Dr. Koi, the numbers that you shared with us in terms of admissions that the KHMHA authority would normally have in a year, 150, in comparison to what it is seen now, speaks to some sort of stress to the backbone of our health system, which are the nurses. Now, I know that the lack of nurses has been a conversation that is ongoing. Notwithstanding that, given that this current wave that we are currently in has not yet peaked, what considerations are being taken for our nurses in terms of the workload? And additionally, how do you see that playing out in terms of if there is any contingency plans that we might be needing more help when it comes to the work that nurses do?
Thank you for your question. And I think most of it will be probably better answered from the Ministry of Health's perspective. But it gives me the opportunity to first thank our national heroes, the nurses throughout this country, who are not only in hospital doing amazing things, but they're going out into patients' homes, they're doing swabbing, they're giving care, they're giving emotional support, they're doing vaccination activities, they're doing many things, many hats that they ordinarily would not wear. And so each of them should be treated as a national treasure. We should treat them in the best manner possible on the street. There should not be targets for any type of negative, perspectives or viewpoints, because they're doing their job. And everything that we do is not about announcements and whatever. It is to try and create the best environment, safest environment for our healthcare professionals, every single one, to be able to do something extraordinary. This is a world war. We are on one of the battlefields. There are many across the world. I don't have the answers when it comes to the attrition, but I can say that in Karl Hushna, for what I have seen, we have amazing people. They have been resilient, they've been patient. Some have been frustrated, some have become unwell because of this, and we fear that some may even have the worst happen to them. And therefore, we will do as much as we can to protect every healthcare worker, inclusive of the nurses. As for the policies and contingencies, I have none where Karl Hushna is concerned. I think that is, again, the purview of the Ministry of Health.
Can we kindly get somebody from the Ministry of Health to respond to that particular question? Thank you very much, Dr. Koi.
I go a bit farther into not only recognizing the nurses who are doing an amazing job and the doctors as the clinical part of it, but I also extend my respect and admiration to the persons cleaning, the drivers. Everybody has this importance and the respect from all of us for the work that they put in as a part of the response. And I started off by recognizing them because we have that sole commitment from the Office of the Prime Minister that wherever human resource is needed, the support for employment as a part of the response is there. And the employment, not only for nurses and not only for doctors, inclusive of drivers, domestic workers, is something ongoing to provide the support countrywide and not for only one specific hospital. Thank you.
So presently there is no real plan, contingency plan as it relates to a worst case scenario in terms of our nurses. That's the question that I'm asking.
If I may? I know that we raised the alarm several months ago about the shortage of nurses at the KHMH. Since then, we embarked on an effort to recruit more nurses. I'm happy to say that we have been able to increase the complement of nurses significantly. Through the cooperation of the Ministry of Health and Wellness, we were able to benefit by receiving the vast majority of the graduating nurses from UB's graduating class. Additionally to that, we have been aggressively recruiting nurses from the districts, and we have been able to get up our numbers. In the COVID ward, we now have close to 40 nurses available to help man the COVID ward. Our complement of nurses on the other wards remains pretty much the same. Certainly, we need more nurses, and that is an issue that has to be managed in the medium and long term. I've also been assured that there is a contingent from Cuba, which includes doctors and nurses who are already in country and are in the observation phase. I think they're in quarantine. Is that correct? So once they emerge from their quarantine, they will help to bolster the effort. So contingencies are there, and they are being implemented.
Thank you, Erson. Next reporter.
Good afternoon, Head Table. Paul Lopez, News 5. One can't help but notice that the minister decided to sit this one out. That's unfortunate, but I guess it's a purely medical head table. But that's not my question, though. My first question has to do with the rationale behind the exceptions made for certain tourist hubs. Many are asking whether this decision is backed by medical and scientific data, or whether it's a purely economic decision being made there.
I think just as we started off, we said that this is a clarification from a medical response task force who's been ongoing on work since, say, 18 months, ongoing work. So hence the reason this press conference has been convened. I think you can see that the economic recovery hasn't been focused only in the economy, but also looking at the health factors. And the decision to go is we have to look into the social benefit and good for the people we serve. And so far the response in managing the pandemic with the tourism has been positive and has worked. It's working. Hence, we cannot have the scenario is not similar countrywide. The implication of the new regulation is where much attention and much, how could I say, control is needed so that we can preserve lives and we can better respond to the pandemic. I guess, I don't know, Dr. Sabido would like to further add into the new measurements and that standpoint.
I'll just add that as a physician, I understand that we have to balance economy and health. Bear in mind that all these nurses, physicians, and other cadre of healthcare workers that the Office of the Prime Minister has given support to hire comes at a cost. And so the money has to come from somewhere.
Mr. Sabido, I just want to ask a quick follow-up question because you presented some data earlier in terms of projections, in terms of what we are seeking to avert with these measures, and I want to ask you that in my second question. But as a follow-up to that question, then is the data showing that with exceptions being given to these tourism hubs, we won't see an increase in cases in these areas, even though the measures remain the same?
Paul, that was your second question. Yes, it was. Sorry about that.
That's a difficult question, and I don't have the answer for that, Paul. The models that the epidemiologists at the Ministry of Health use don't put these factors into those models. It's a purely scientific model based on infection, based on data, based on all the indicators that Dr. Marcelo Coy mentioned. So.
Thank you.
I'd just like to mention something with regards to the San Pedro and Belize City.
Go ahead.
Just further to what Dr. Sabido said, because in August of this year for Belize City, as we know, a lot of the outbreak is focused in the Belize district, and especially for Belize City, the numbers are the highest. And from August of this year, we started seeing the numbers creeping up from about 150. Early August, it was 286. Now, today, we have 740 active cases in the Belize district. When you look at the positivity rate, as Dr. Koye had mentioned, for Belize district, it fluctuates between 8 to 10. When you look at San Pedro, for instance, and the cases in San Pedro, the cases have remained pretty much between 30 and 40 on a regular basis, and the positivity rate is much less. So we also look at that, and we do know that the hotspot is Belize City as well. So if we look at the data from the last outbreak in October, November, December, and we see that in December, I think that the total cases we had were 9,500, almost 4,000 active cases at that time. When measures were placed in, I believe like it was the latter part, just before Christmas, like December 18th or 19th, we had placed in some stricter public health measures. At that point, it took us almost 4 to 6 weeks to get control. The numbers continue to rise because there is ongoing transmission even when you start to set new measures, there's still ongoing transmission. And I think that after the 6 weeks, we were able to see a peak at that point at around 12,000 total cases. So, you know, even with all that Dr. Koye has said, as well as we have the facts, we have the data here as well, we know that public health measures work. When you look at deaths, for instance, I think that in the latter part of January, we were at about 300 deaths. And once we started to control the numbers and people started to recover and we started to see the curve coming down, we had from February to June, in total, we had 29 deaths. In August, we had 22 deaths in that 1 month. So imagine we had over almost 4 months, 29 deaths. 22 deaths in August, and now in September, we're at September 16th, and we've already had 27 deaths. So, you know, the numbers are telling us that there are measures that we have to take. We've got to do it quickly. And we know that it worked because it worked in the last outbreak as well. So just wanted to add that with the actual numbers for the Belize City and San Pedro as well.
Thank you, Minister. Doc.
Dr. Koi had comments as well. Paul, you see, I gave you 2 questions and you had 4 extra comments.
Yeah, I just want to add that whenever there is movement, as I made in my presentation, there is risk increases of transmission of the disease. And if you are going to say we're going to extend it in certain areas, obviously that is a risk factor towards increased transmission. Nobody will lie to you and tell you that. But the people who are coming into the country as tourists all have a negative test, whether it is the rapid or the PCR, they do have a negative test towards infection. So it means then that that risk is decreased by the fact that the people who are mingling in these tourist areas are people who are coming in with a negative test. It's not the same as free mingling and people who have community spread. So you balance, yes, the risk increases because you're extending the hours, but you minimize it because the people who are coming in that area are have negative tests.
Okay. Good afternoon. You're on Humans Breaking Belize News, and piggybacking on what you said, Doc, the contact tracing, and that most of this is related directly at you and Dr. Mendes as well, but the contact tracing, and particularly here in Belize City, what has that been telling you about where the virus is originating from? Is it confined to a particular neighborhood or a set of neighborhoods, or is it across the city? And then also in terms of the other municipalities and the outlying communities, because if you look at the data, you see the same villages cropping up with cases in the area around Orange Walk, could be Trial Farm, Carmelita, for example, and there are others, but what does the data tell you?
Yes. Well, thank you for your question, and I didn't want the press conference to be over without mentioning, I know we've spoken about doctors and nurses, and CEO spoke about cadre of staff, but a very important cadre of staff in this fight and in this response are our surveillance team, our primary health care team, our public health inspectors, and they have, to say that they have gone above and beyond is definitely an understatement, because we have, many people have had additional duties. We've done a lot of training for environmental health staff, etc. So I really wanted to acknowledge the work that our team, that we are doing constantly at the health facilities. We have 11 health facilities in the Belize district. We have 5 vaccination sites ongoing. So, you know, it takes, it's a lot of work that's been put into it. But to answer the question with regards to the spread, for Belize City, we can safely say that we do have community spread. We don't have clusters in any one place. When I get the report at the end of the day, many times it's all over the city. Many businesses will attest to the fact that they have 1 or 2 staff at least who have tested positive already. And like Dr. Koi had mentioned before with regards to the row and to the spread, once you have 1 or 2 staff members in a small area positive, we know that when we go in, we will pick up another 3 or 4 staff members being positive as well. And for that reason, we try to reiterate, we stress the importance of the public health measures in the workplace, because we do want the economic recovery to continue, and we do want places to remain open, but the public health measures are key in order for businesses to continue to operate. We have seen definitely certain clusters in certain businesses and in certain areas in Belize City, but on a whole, I don't think that we're looking at clusters any longer. Like prior, we were looking at maybe a church had a cluster or the casino had a cluster. Now it's widespread. Thanks.
Okay. And then, Dr. Koye, you spoke about the condition of patients coming into the hospital. It doesn't appear to discriminate among unvaccinated or partially vaccinated or fully vaccinated. what is the patient profile, if you will, of who you're tending to? Because there are certain underlying conditions we know that this virus tends to attach itself to, that tends to accelerate illness and ultimately death. So just an idea of the patient profile.
Okay, thank you for
Thank
your
you, Aaron.
question. Can you hear me? Yes. So I can tell you this information regarding the 67 admissions for this month, where 49 were unvaccinated and 11 having a first dose, and 7 patients having 2 doses of vaccines. But sometimes, as you know, they may get the second dose in almost very closely in the interval to exposure, and some patients do get COVID subsequently even after the second dose. So I would say the definition of vaccination, as we wanted to emphasize once again, unless it's the Johnson, which is a single dose, then it is 2 doses and 2 weeks after the second dose. So I would then say, by the statistic I'm sharing with you, then that 73% of the patients had 0 vaccine, or 90% of the patients are unvaccinated by the definition I gave you. So as to comorbidities, it is very important. The patients, and we've had 2 patients who have died who were fully vaccinated, which is fairly common knowledge by now, and these patients had several, and if not many, comorbidities. So again, it's not for us to test the vaccine. You know, in the UK, they presented their data, I think yesterday, and I believe for breakthrough infections, which is what they refer this to, this phenomenon to be, it's about 0.9%. And there are deaths that can happen as a result of breakthrough infections. So COVID is nothing nice. And we think we may know some of the things about it, but we just don't know all about it. And that's the reason why we should never relax our public health practices and measures. The vaccination activity is just one arm of what has to be done. And every person has their individual responsibility for themselves. You have to be selfish in that sense, and for the others who are around them. And I cannot say any more than that, because no matter how you look at the analysis of things, nothing will come purely except for the fact that if you are exposed and you have a high degree of exposure, then the chances are you still can get COVID. You can have COVID and you think, well, I had COVID and I have antibodies and this and that, and you measure and spend all the money and throw it away on those tests, you can still get reinfected. So again, there is really no mystery. It's a virus. The virus don't think. We are the ones spending all the time trying to think and outthink it. But in the end, we are the ones carrying it around and sharing it around. And that's a fact.
Thank you.
Good evening, Head Table. Hippolyta Novella, Love News.
Excuse me, I just want to make a comment to put some numbers to what Dr. Koi said. Since the rollout of the vaccine, at the KHMH, 134 of our admissions were unvaccinated. 31 had only the first dose, and 12 had the second dose already.
Go ahead, Hippolyta.
Okay, thank you. Okay, so my first question has to do with exemption of locations in terms of the new regulation. Was it a task force that recommended that these tourist destinations be exempted from the new regulation? Because I ask because wouldn't that be counterproductive? Because then what might happen is that these areas might become COVID hotspots because Belizeans who are running away from regulations might run to these areas, taking the virus with them.
So the answer to that is no, it was not the medical response team that made those recommendations.
Now, in terms of that 2-week period, 2 weeks because for someone to clinically recover from COVID, it's 10, 14 days. And so what happens when after 2 weeks, nothing has really changed? Would then the task force recommend that a total countrywide shutdown be implemented?
Thank you very much, Hipólito.
Mr. Novello, the recommendations coming from the World Health Organization do not or are not advocating for any total country lockdown. And I think I can speak for the medical response team that if we see that it has not subsided to the point that we can get some form of relief at our medical institutions, then we will continue to recommend to the government that either they extend it or do implement measures for where the hotspots are, but a total country lockdown is not recommended.
Good evening, Courtney Menzies, Channel 7.
Sorry, Ms. Courtney,
sure, no
Dr. Koi wanted to make comment as well.
Sure.
Sorry about
I
that.
want to mention that,
Yes, it's on.
that decisions are data-driven, all right? It's not what I think or what Dr. Sabido think. And so we look very closely at, as I mentioned, at the positivity rate, the death rate, and the hospitalization rate. That is what's going to determine whether it will extend. It certainly wouldn't be shortened, because once you reach to these levels, the turnaround time to bring it down to less than 5 is not going to be a week or 2 weeks. In fact, it may be as much as a month. But the answer is data-driven. It's not on anybody's fancy.
Thank you very much. Ms. Courtney.
Okay. Like Paul, I also want to note that there is no DHS rep at the head table, which would have been my first question to the minister. So instead, I'll ask about vaccine expirations. We had, I know we had a recent shipment of J&J, which is I think 168,000, and I think we have 2 pending shipments of Pfizer. It's great that we're getting all these vaccines, but as we can see that the vaccination numbers are slowly climbing up. So can we talk about if the ones that we have now are in any danger of being of expiring in the near future?
The Johnson & Johnson vaccines that we recently got have an expiration date of, I can't remember the month, but it's 2023. 24? 23. The Pfizer vaccines, we just got communication from CARFA that those that were to expire in November, the data is showing that they can be extended, or it is recommended that we extend it to February 2022. That is information that we got on Monday from the Caribbean Public Health Agency. So we do not have any vaccines that are going to expire on us. Most of them have been in arms. What we try to do is first in, what we do is those that have the shortest expiration date, we start to use those and send them out to the region so that those are the ones that are being used.
Yes, I just wanted to mention a little bit about vaccines, and of course I'm talking about the Belize district, because I know that generally a lot of people are saying the numbers are creeping, but I want us to keep in mind with AstraZeneca. So our country has been very fortunate. We have 4 vaccines at this time, and we're one of the first countries in this part of the world that got vaccines in early March that are not British territories or other territories. So I think that has really helped us. But what we've got to remember with AstraZeneca is that it takes at least 10 weeks before you're fully vaccinated. And before, I mean, the data shows that if we give it 12 weeks, the second dose, you know, it's even more effective. So initially, when we had good control and the positivity rate had remained below 1 for more than 4 weeks, we felt, okay, we have data to say that we've controlled that outbreak. So now we're going to try to give the Astra for 12 weeks. So then really it was taking people 14 weeks. I know this is laboring, but it's very important. It was taking people 14 weeks to get fully vaccinated. So now in the beginning of June, I think, or the beginning of July, the full rollout happened with all phases. So now we're giving at 8 to 12 weeks the second dose. And we're encouraging, at least we at the Belize district, especially with the outbreak, we're encouraging people to come in for their second dose. As Dr. Corey mentioned, you're not fully vaccinated if you have 1 dose. That's really important for us to drive home in this conference. The data is based on fully vaccinated persons, meaning 2 doses and 14 days after your last dose. So that's important. We're asking people to come in to get the second dose. So if you look between the first dose, so far we have about 90,000 people fully vaccinated and about 180,000 with the 1 dose. Now with Pfizer, because it's 21 days or more between the 2 doses, we hope to get that number up much faster, and you all will see it that in a few weeks you will see the numbers going up quicker. And the large amount that was given out at, I believe it was the beginning of June when the phases open, or the beginning of July, you will see now it's the time that these people should be coming in to get the second dose. So we feel that by the beginning of October, we will see that number going up very quickly. In addition to that, having only recently gotten Johnson, and Johnson is 1 dose, we know that up to 14 days after you already have in the 80% or above some kind of protection, and at 28 days it goes up even higher. We will see the fully vaccinated number going up significantly as well. So that's just something that, you know, we want people to keep in mind, that it's not that it's lagging. Yes, we do want a lot of people to come in. We know that the vaccines have saved lives. There's data from countries all over the world. It reduces hospitalization. So all these things, it's very important for us to stress and encourage that that is the way. The public health measures are put in place to give us some respite, to ensure that we save lives, we reduce the transmission, and we're able to then safely vaccinate as quickly as possible.
Thank you. My second question has to do with casinos. I know in the regulations it says that they have to close. The workers were concerned because the regulations already are that all people who work at the casinos and the patrons have to be vaccinated. So now they're concerned that they've done their part, they've gotten vaccinated, and now they're out of their livelihood, so to speak.
Yes, well, I mean, we do know that for churches and casinos, the recommendation in any place where you have, like Dr. Marcelo was mentioning, singing, shouting, congregating, and especially people from different families. It's not, you know, you'd go out with friends, etc. You will see spread. It's important for the general public to know that these measures aren't etched in stone. It's not something that's forever. We're asking the general public, we're appealing to the public to help us to enforce these measures, because we want to get to a point that we can control that upward movement of this curve. We want to plateau and to eventually reduce the number of cases that we have. So looking at these places where there's a lot of congregation and a lot of socializing, we feel that taking these measures will really help us to reduce that spread.
Dr. Koyi had comment also.
Yeah.
Go ahead.
I think we need to clarify that vaccination is like a personal insurance. That if you take your 2 doses and in 2 weeks, it minimizes the risk of death. Vaccination does not stop you from transmitting the virus. So when you say that the workers at the hotel are vaccinated and will do bad, it's because it does not prevent transmission 100%. And that is the reason why they say they have to stop activities at the casino. So vaccination, no work day. All right, so just want to clarify there's a difference between vaccination and transmission.
Thank you.
Thank you as well, Courtney. So we have exhausted the reporters here this evening. We thank you for the question and answer segment. We have, before I do an official closing, we have some comments by Dr. Andre.
Yes, if you allow me, I want to give a shout out to our KHMH crew, all those at work on duty and those at home. But really, what I want is to appeal for consideration to doctors and nurses and staff working at the KHMH. We work outside of conventional hours, and so our staff have to be moving outside of the normal hours, and we would want to ask consideration from the security forces and from all those who in some way they may interact with, to enable them to reach home, to enable them to reach work, so that we are able to continue the service that we provide.
Yes, I appreciate your comments, and if anybody else on the head table would like to give a shout out.
I just want to appeal to the general public, those of you that have not been vaccinated, please come and ask for your vaccine. And I say ask for your vaccine because we have, 4 vaccines now, and Pfizer is now available to the rest of the population. So those of you that were waiting for that, please come and get your vaccine. Those of you that only have 1 dose and your time has passed, please come and get your 2nd dose. Scientific studies show that those who have 2 doses, or those who are fully vaccinated, have less viral load, and by that, then it goes to that you are less likely to spread the disease. But please note, less likely, not, there's, as Dr. Koi said, there's no zero risk. So please come out, vaccines are there, our vaccination sites are open. Thank you very much.
Would anyone else want to give a final appeal?
Well, I'll just close out by thanking all the viewers for joining us and the media for being with us today, and the members of the task force, even those who are not present, who have been daily and continuously providing advice and looking at the data and information that we receive on a daily basis, as what has been expressed also for the consideration of all healthcare workers, and I include at all levels, all persons, all staff who provide services at our health facilities, for consideration to be given to them, and I applaud them and recognize each and every one of them, especially during this time as we celebrate in Belize our independence. I also support what Dr. Sabido has expressed, inviting all viewers, women that are pregnant, you are free to be vaccinated. Think about your child and think about the children that you may leave behind if you decide to run the risk of not being vaccinated. It's free. Don't let anybody charge you for this vaccine. It's yours. It's for you. And we are here to serve you and inviting you to please access everything that's being given to you through the services of the Ministry of Health and Wellness. And thank you very much for joining us today.
To officially close, we have come to the end of this press conference called by the Ministry of Health and Wellness and also the members of the medical response team. I thank the media houses who are here with us this afternoon, those in the airwaves, on television, if we are streaming live on the World Wide Web. I thank you, and I ask everyone to please be safe.
We must all unite as one. It's the only way we'll stand. All for one and one for all, because divine